What if your blood was so thick it caused you pain and was life-threatening? That's the day-to-day struggle for our next guest.
My name is David, and I'm 54 years old. I started experiencing fatigue and shortness of breath after I turned 40. I noticed I couldn't be as active as I had been in the past. I was an experienced skier, and I could no longer make it down the mountain without stopping several times. I was also an experienced scuba diver and can no longer dive anymore. Over the next couple of years, my symptoms increased. I began to have pain all over my body, trouble concentrating, and terrible itching. Now walking is my primary exercise, and even that takes effort sometimes. Severe chest pain was really the final straw, and in 2009, a blood test revealed that I had PV.
Here to tell us about Polycythemia Vera, PV, and who may be at risk is Dr. Steven Stein, Chief Medical Officer of Insight Corporation. David also joins us today. And thank you both for being here. Dr. Stein, can you explain to people what's going on with David or someone who has PV?
Sure. There's a group of rare blood cancers called myeloproliferative neoplasms, or MPNs. They affect about 200,000 Americans. They tend to occur in patients who are over the age of 60, but they can actually occur at any age. David has the most common type, Polycythemia Vera, or PV. With myeloproliferative neoplasms, the body's bone marrow makes abnormal blood cells, either too many or too few, and they can be irregularly sized or shaped. Just to illustrate that, I'm going to use this for a second. On this side is normal blood, and over here you have Polycythemia Vera, where red cells are overproduced, which causes a tremendous thickening of the blood.
Thickening blood could lead to things like clots, which can block blood flow through arteries, veins. This, in turn, could result in something like a heart attack or stroke. Now, thicker blood doesn't flow as quickly through your vessels as compared to normal blood. If you look at normal blood flow there, you see how nice and smooth it is? When you talk about really thick blood, you'll see how it just doesn't want to flow through those vessels as cleanly. And David, you described how you felt. Everyone's a little bit different. What are other symptoms that people might have?
So with Polycythemia Vera, something that can be interesting is that symptoms within a particular patient can vary in intensity over time, and it can actually vary from patient to patient. So it's important that patients be aware of them and describe them to their doctors. They can vary from things like fatigue, headaches, dizziness, itching, which is actually very common, and even chest pain.
Blood tests can determine if you do have PV, and if you are diagnosed, obviously you should talk to your doctor. You want to consult with a hematologist or oncologist, someone who specializes in blood disorders, so you can regularly check your hematocrit levels. That's the volume of red blood cells in your blood. David, you've become an advocate for PV. For those who are affected, what is your advice?
I would seek out resources and become knowledgeable about your disease. Ultimately, I knew nothing about PV when I was first diagnosed, so I turned to social media with informed patients to learn about the illness. I created a website that's patient-focused for myeloproliferative neoplasms called pvreporter.com. But above all, it's important to work with your doctor to achieve symptom control and find the best treatment for you.
Dr. Stein, what else should we know about PV?
Yeah, so currently there is no cure for Polycythemia Vera, but properly managed, the disease and its complications can lead to a relatively normal lifespan. It's very critical that the treatment be individualized for patients so that the complications are managed. If you want to know more about it, you can go to a website called pvstateofmind.com.
And incidentally, you can always visit thedoctorstv.com. Dr. Stein, David, thanks so much for joining us.